Hello and welcome to Health Matters on Channels Television. We are glad you could join us. I am Mary Alale Yusuf. Malaria is transmitted throughout Nigeria with 97% of the population at risk. That's according to the Severe Malaria Observatory. According to the 2021 World Malaria Report, Nigeria had 26.6% of global malaria cases, the highest, and the highest number of deaths as well, at 31%. The country accounted for an estimated 54% of malaria cases in West Africa in 2021. A new species of mosquito is driving up malaria infections in Africa, fueling a growing public health concern. According to the World Health Organization, the Anopheles stephensi mosquito, shortened by some entomologists to Steve, has been detected in 7 African countries so far. The mosquito, which originated in South Asia, was first detected in Djibouti in 2012 and has spread to Ethiopia, Kenya, Nigeria, and Ghana. My guest on the show is Professor and Consultant Medical Parasitologist and Malariologist, Director D.K. Olukoya Central Research and Reference Laboratories, University of Lagos, and also, among other things, lead Andy Center of Excellence for Malaria Diagnosis. He's Dr. Wellington Oyibo. Welcome to the show, sir.
Thank you very much.
Let me first ask, is this a vector that has been there, but they're just discovering it? Or is this an evolution of another vector that we are seeing as Steve?
Yeah, so Anopheles stephensi actually has been there. Of course, it has been, around the areas in Asia, and that is where it was known to exist, of course, existing within urban areas, promoting urban transmission of malaria in India, Sri Lanka, and other countries in Asia. So, but basically, of course, within those areas, they still hotspots for malaria because the dynamics of malaria transmission in Asia really is quite fragile. So, of course, you'll be hearing about the Thai-Cambodian border and areas where you really have quite a lot of drug resistance. So that's still the zone, the drug resistance zone in the world, where both the parasites and the vector are making things happen the wrong way for humans.
So if stephensi has been around, how did it get here? I mean, do tourists bring it? Visitors bring it? I know there's a lot of traffic between Asia and Nigeria, but why just now?
Yeah, of course, you have to now understand the dynamics of migration and the dynamics of, climate change. All of these migration, climate change will catalyze new entries of vectors into newer areas. And that's the reason why one of the things that is done is the surveillance. You keep on watching at what exists in your environment, and then you can spot quickly what those threats are when you have new elements, like a new species of mosquitoes coming. And basically that was what was done. And don't forget too that, as you have, Djibouti is a shipping town, okay? And then, of course, when this ship move around, mosquitoes could come in those places and they can come out. You've had instances around imported malaria as well, even through the airport. When the aircraft come in, they stay open in different places. So we've seen outbreak of malaria in areas around Italy, Rome, during warm periods, and you see those, they call it airport malaria. So within those areas and the period when the vectors can transmit, or can bite and can stay in those areas, they transmit malaria. Of course, you see the events going on in Florida.
Okay, so let's get this straight.
Yep.
Is it the vector coming that causes malaria, or can it also be maybe somebody infected with that particular malaria coming in?
It has to be vector because malaria is not transmitted. The most primary ways by which malaria is transmitted is through the vector. So that vector has to bite and pick up the parasite from humans. So when you have what they call the vector and parasite complex, that means they're both available. And that availability triggers those initial bites.
Okay, so let's break it down. The vector is the mosquito itself.
Just the mosquito, right? And then the parasite is what causes malaria. And when the mosquito, a new mosquito comes and tries to survive, stays in that environment, then bites man, of course, they begin to propagate. And of course, for Stefansi, it's as rugged as being able to withstand any available environment for them to survive. And that is what gives room to the inbreeding. And then you now begin to see the spread.
The spread.
And now the threat around that is its unique nature.
Aha, that's where I wanted to go to next. You've already told me Stefansi is rugged.
Yes.
How else does it differ from other malaria vectors, like the falciparum? But isn't falciparum also rugged?
Okay, falciparum is the parasite.
That's the parasite.
It's the one that really causes the most threatening malaria.
What's the Anopheles mosquito we are used to?
We have Anopheles gambiae.
Aha,
you have Anopheles funestus, and you have Arabiensis. So most times you have the female Anopheles gambiae, and in other areas you have Arabiensis. So these are, of course, in their own right. But one of the things we see here as a threatening part of how the mosquito is engaging man to worsen the scenario for malaria is how they begin to bite outside the home.
Yes.
Outdoors.
No, but my question is,
yes.
How does Stefansi differ from the Gambia and the Arabia?
It differs for many reasons. You see, Anopheles gambiae, you can see it thrives in tropical environments. It will transmit Plasmodium falciparum. Now, you have in some other places, you have other species of malaria like vivax, which will condition themselves to very cold, temperate environments and then transmit that virus. Now, what you see with Stefansi can transmit this virus, transmits falciparum, whether it's a warm environment or not.
So it can subsist and survive in different types of environments.
Yes, and different types, but mostly warm environments, but their ruggedness in the dry season. You know, what the mosquito thrives on is the access to clean water.
Okay.
And in dry season, those periods, you hardly find those water collecting, unlike when you have on the rainy season where water collects. So every availability of water, maybe you have water cistern open, you have water hanging anywhere, you see them happening, especially in the urban areas. And this is a scenario again, that these Stefansi, because of the opportunities they have in urban settings, where the environment permits it, having multiple collection areas for water, then it gives them the opportunity
to breed.
And they will not only breed, they have a capacity that could even change and affect the parasite itself, making the parasite a little more resistant and even more destructive in a way. Okay. Yes, more destructive in a way. And then, of course, they can bite outdoors. When they bite outdoors, it means that you will need a different strategy to deal with them. You have to be targeting their larvae.
Okay.
So if you're using nets at home, you see not safe because they're available outdoors.
Inside water bodies?
Outdoors, outside the home. If you're relaxing, you have a garden outside, you know what happens?
You're not safe.
You're not safe because the typical Anopheles gambiae mosquito will bite you between 10 p.m., 11 p.m. until 1 a.m. Indoors. So what they do in the morning, they get out and they go to hide in your all dark places, wardrobes, waiting for you. Of course, when you were sleeping, 10 p.m., 11, they bite. Those are the typical biting periods. 1 a.m., 2 a.m., they bite and they go hide again. Now, these are out, they can bite outdoors. So if you're relaxing outside and then you're doing some other activities, maybe where you have agricultural areas where you're working, then they're outdoor biting. And that's, again, a challenge in the mosquito control program. So that when you have outdoor biters?
We already have atmospheric spraying, right? Isn't that enough? Or are scientists rethinking their outdoor spraying strategy?
So the target has to be clear now. First of all, the recognition that you have adult biters, and you
outdoor
have
afternoon biters.
They could be, yes, outdoor afternoon biters, evening biters.
Which makes it worse.
They're outdoors, yes. So, and which means the strategy of using the nets becomes reduced. It doesn't work for those.
That's
You
right.
can carry nets around and working. So it meant too that the larvae has to be targeted. You target the larvae, and of course they do indoor residual spraying. You want to target spraying, the drains or whatever. But the larvae is critical.
How do you target larvae without contaminating water sources?
There are environmentally friendly process by which you could do that. By the way, you may not be, the interventions are multiple, okay? You're not going to put something in your drinking water, but you look at water collections around the place, the homes or around areas in urban cities.
How about lakes?
So you could target some lakes, you can target, that's why you see you now have what is called the targeted treatments, interventions. And when you're targeting those collection of water body, there are certain kind of bacteria you can put there, there are certain kind of chemicals you can put there. So you target the larvae. And when you target the larvae, then the adults will not have any challenge of growing. So you won't see much of the adults. So the strategies now have to be clear. Even for now, there are other mosquito species that bite outdoors. So, and it's a challenge. So what has to be done first is identifying where those adult biters are through surveillance, and then knowing where the indoor biters, the usual ones, are, then your strategies are clear and balanced. And there's a new phenomenon now that's, is really tricky, having to do with urban malaria. So when you have the people living in cities, of course, in the cities, you apply other interventions, you use aerosols, you screen your homes and that. But you come out and you're bathing, then the mosquitoes outside has to be targeted. So you do that by doing what's called larval source management. And then you want to do your adult spraying, you can do those for the adults. But essentially, the larvae are critical. Of course, there are new tests, there are new interventions coming up now that you could really have a device. And you can put both outside the compound and inside. It has the capacity of differentially attracting mosquitoes to be killed.
Okay, we'll talk about that after the break.
Great.
Stay with us. We are coming back. Let's see if we can beat Steve. It's time for a break. Welcome back. It's Health Matters on Channels Television, and we're discussing the malaria situation here with Professor Wellington Oyibo. And you can call if you have questions about malaria. You call 0808-054-2233. You can also send me a message on X at CTV_Mary A, or send email to moalale@channelstv.com. Now let's go back to that strategy you were talking about to trap vectors, or let's call them mosquitoes, so people understand, outside the home.
So great. So now we're talking about a disease, and we're talking about the influence of a vector that could threaten or worsen the existing, statistics you've given. Nigeria remains the highest burden of malaria globally, and we've been there for a couple of years. So the interventions are critical in prevention. And of course, vector prevention forms one important strategy that really has to be implemented. Now, if you have a unique vector that can increase from known data, that's, can increase the cases due to, increased transmission, it meant that areas where it has been identified, some very serious intervention had to be done. First, when the surveillance is done and you identify the mosquito in that location, the first thing to do is to increase awareness on the existence of that mosquito. And then you want to see how you contain it. So to contain it means that these are not the usual mosquitoes that would come to bite you at night. They will bite outdoors. They could increase their survival at periods when transmission should be low. So, and because they can survive in beats and places where you have any water collecting, it makes it worse. So, like I said, there are targeted intervention. There's a new intervention on board, which hopefully will change the dynamics. It's called the attractive sugar beds.
Okay.
ATSB, and it's a device you put it outdoor, and it differentially attracts mosquitoes, the adults. So outdoor, it can take care of this, and then of course indoor as well, it could attract them and then kill them.
Is it a government intervention, or is it something we can do ourselves, like going to the shop and getting insecticide?
You can get it now, but it's on board. So there are trials that has been done that shows that yes, it could change the dynamics of vector control, and it's environmentally friendly, and you can actually democratize its use in different areas. But other than that,
you spoke about
the laboratory management. Yes,
you spoke about our interaction, our connection with the disease.
Right.
What does this mean?
The expectation is that when you have this kind of vectors, you have more cases. And it's been shown through modeling that we might likely have additional 138 million cases.
Wow.
If stephency is not properly checked.
138 million
cases.
Okay, let's get to work.
Yes, so and those are the threats. So if you use it's like having Ebola, it's a disease that can kill immediately. If you have a threat for stephency, the recommendation assume that everywhere is stephency, right? Because the reason here you have malaria in pregnancy, the effects of malaria in pregnancy is not appreciated by the population. I hope we can talk about this now. That you have a parasite transmitted by vector.
Ask you to hold that thought?
Thank you very much.
And let's take this call from Ruben. Hello, Ruben.
Hello.
Please, what's your question?
Please, my question is, why is it that malaria comes almost every week at an individual, even after treatment? What is the cause of it?
Ruben is asking, we'll get to your question, Ruben. Why is malaria everywhere, even after treatment? And then sometimes some people have to be treated twice before it goes. They go to the same hospital, they're tested again, and the doctor says, you still have malaria, let's treat with something else. That's Ruben's question.
Yeah, so we go back to yet another area. Was there really malaria? Was it malaria that was treated?
Okay.
Because the interventions currently available using the artemisinin combination therapy works. And the federal government does that dutifully to ensure that every 2 years they have multiple sites where they assess the sensitivity of those medicines. Okay. And for some of those medicines that we have recommended by the Federal Ministry of Health, they're still very sensitive so the first thing, did they test properly for malaria? Was it confirmed? And was the quality of tests? Because if you have confirmed malaria, the medicine should work. But if it was done presumptively, or the quality of the test is questionable, then you can say you have that. You should not treat malaria multiple times. So again, it goes, was a better test done? Yeah,
then
before
treatment.
Then
if the doctor said there's still malaria, I'm coming back to you.
Then you go back, you can treat.
All right, you were telling us about the pregnant malaria in pregnancy that is not appreciated.
So, and that's why if we're talking about mosquito, what do you expect the general public to be aware of? Because the adults can have malaria and still maybe go to work.
Oh, definitely.
Right? And that's the challenge, that malaria has been so commonized. Malaria is commonized in Nigeria. We are not taking the right actions. We should take the right actions. I hear people talk about what government can do, but we all need to take the right actions. And again, you see that where you have a pregnant woman having a very strong reception for the parasite to be in his placenta, that's a threat. How many women knows that just being a woman in Africa or being a woman in Nigeria bitten by a mosquito that has a parasite, then you have that parasite, going to your placenta.
In your body and in the child's body.
It will go to the body, but will most likely now go to the placenta for pregnant women.
Let's see if we can take Ibini. Hello, Ibini. Are you there?
Yeah, afternoon, ma.
Good afternoon. What's your question?
My question is, there is this case of cerebral. Then what can be done? What can we do to prevent cerebral malaria?
Okay, that's an advanced one, but I'm sure it has a simple answer. Okay, all right. So, Igbini is asking about cerebral malaria. How can it be prevented?
Again, you go back to the basic. It's just a simple thing. If you're not bitten by mosquito, Anopheles mosquitoes, then you can avoid that. And I want to say too that, in certain places in Nigeria, you could have higher risk of cerebral malaria because you now have some successful control going on. Okay. Like in Lagos, for instance, the digit for malaria has been under 5%. So, and the more we live here and our children are protected in our good homes, we don't have the immunity among those guys.
It reduces the immunity.
Yeah.
So
and then they go to these boarding houses where they're exposed and they could really come down. And that means the primary prevention for every one of us. Leave government alone. Can you do that individual household protection?
Okay.
How are we ready to go to work on our environment?
Clean the environment.
Clean the environment. Like you see, the mosquito must breed somewhere, okay? We talk about Stephensi going and knocking on every door. They will knock on the doors because you left some cups and tires open with water. And if you maintain all year-round transmission, which we should not, because you confront the one of the rainy season because you can stop it from raining, then we will have people spending more and falling sick due to malaria. Okay. So the action is for us to take really prevention.
Take care of your environment.
Yes, prevention, and use those prevention at home.
I have to interrupt you there,
Thank
Prof.
you.
We've run out of time, but thank you so much. You have hit the nail on the head. We have to take responsibility for it.
Sure.
Thank you so much for coming.
Thank you very much. Always a pleasure.
Ladies and gentlemen, thank you so much for being there and watching and listening along with us. Have a wonderful day. I am Mary Alale Yusuf.